Dr. Sherry as she continues with our presentation today, and while we're waiting for others to join us. Thank you.
Okay, good evening, everyone. Okay, we're gonna start with a presentation that was requested. So I was trying to make sure we're able to stream live on YouTube. So that's what took a minute. So we're gonna start with this presentation. Okay. Jetia, can you please make sure you admit people? So the presentation we're talking about today is something that was requested by one of our frequent participants. So the title is Meningitis Vaccine for Teenagers. They were really curious about what it's all about. So we did some research and this is what we have to present. So meningococcal disease is caused by a type of bacteria. It can it can result in infection in the bloodstream, which could be sepsis, and it can also cause meningitis. And meningitis is really a serious infection that affects the covering and the lining of the spinal cord and of the brain. Even with antibiotics, it's still really very serious problem that can lead to seizure, brain damage, stroke, deafness, and so many other things that you don't want to deal with, especially as a teenager or even a young adult. Please, if you're not speaking, please mute yourself, please. And so now we're going to talk about how does it relate to vaccination to the teenagers. The meningococcal vaccine is a shot to help prevent the disease, right? And the disease is common in babies, teenagers, and young adults. And this vaccine can protect against the most common type. So there's more than one type you're gonna find out, but this vaccine can prevent against those common types. So let's look at it a little closely. I think pictures always explain things better and clearer. So I really love this picture. What is meningococcal meningitis? It talks about it again, about the bacteria, the one that is the bacterial one that's the most serious one, the life-threatening one. And it can affect, as I said earlier, the bloodstream infection, then it is referred to as sepsis, and it can also affect the brain and then the spinal cord. So these are some of the symptoms. You can see high fever, stiff neck, vomiting, headache, exhaustion, and purplish rash, not just any kind of rash, like purplish color. And then also, what are the main way that you can spread? That's why when students are going away to college, when they're like in like closed environment, it's really recommended that the students will get this particular vaccination. So it can spread with utensils anywhere, anything you use, you share saliva, cup, receptacle, knife, forks. And also people living in close quarters, somebody sneezing on another person, kissing, and also e-cigarette and vaping and even hookah. So those are avenues that this can readily spread. And this seems like these are some of the things that the young people engage in, right? So who should get vaccinated? So these are the recommendation from CDC, the person that should get vaccinated. Teenagers going to certain countries, including Africa, and college students, teens living in close quarters together, such as dorm, college campus, or military barracks. And there's also some teenagers that go away to camp, or they go away to boarding school. So they also will fall into these categories. Teenagers living together, teenagers with weak immune system, or maybe teenagers that are taking medication that sort of weaken their immune system, like chemotherapy or transplant medication. So this vaccine is also recommended for them. Teenagers whose brain is not working or is not working right, students who work with or study meningococcal disease in the lab. That means you've been exposed to the live virus. So of course it makes sense for them to get vaccinated. So this is just a brief overview of how the vaccine works. I think I can call on any one of you on this platform and you'll be able to explain this, because you guys are professional about how vaccine work. But we've been speaking for over 2 years about COVID-19 vaccine, and they basically work around the same way. This vaccine, it triggers the antibodies that we already have in our system, and that antibody helps to fight the disease the next time the person is exposed to the virus. That's the basic summary of that. So there are two main types of vaccine. Remember earlier I said there are different types of the meningococcal meningitis infection. So there are two types of vaccine that can really help to really prevent this disease. So the first one, I'm going to go to the first one, then I'll talk about the second one. So the first one is the meningococcal ACWY, and it's advised for all teenagers. So this can help to protect against ACWY type of meningococcal disease. So it is in 2 doses. It's given when the first dose is given when the child is between 11 and 12 years old, and the second dose is normally given around 16 years of age. So if you have any teenager in your home, you're gonna get letters from the school reminding you that before the kids come by, they're gonna get vaccinated. This is really mandatory for them to get it. So if for whatever reason the child didn't get it early between the age of 11 and 12, they can still get it at 13. They can get the first dose at 13 and get a booster shot between 16 and 18 years of age. So the other type is really for kids that like have weak immune system, is very specific, that have certain kind of health condition, weak immune system, whose spleen may not be working, or they've been exposed, to meningococcal infection. Maybe they were living in close quarters and people around them had the disease or something like that. Then it's recommended for them at that age, at that time, I should say, and it may be given up to 23 years of age. So that is the second one. So, the ideal situation would be if it's possible for all of our teenagers to get both together, but based on what is going on and the situation, your doctor will decide and let you know which is the best. But this first one is recommended for all teenagers. So you want to really be mindful of that and remind your doctor. Most pediatricians will remind you, but just in case, because so many things happen around the pandemic and a lot of things got forgotten in the idea of us focusing on the pandemic. A lot of people forgot about all the other vaccinations that are really essential to well-being. So this is one of those. So let's look at the side effects, because that's the first question that people will ask. Okay, we have to take this vaccine. What are the side effects? So the side effects are often very mild. Of course, when you get any kind of vaccination, you have swelling, tenderness in the area where the injection is given. That's one of the main side effects: nausea, diarrhea, headache, joint pain, fever or chills, and rare allergic reaction. Of course, if this side effect becomes unbearable, you want to reach out to your doctor or call 911 and be able to seek the help that is needed. So of course, also call the healthcare provider if you have high fever, vomiting, and the tiredness or the fatigue doesn't go away even after you have rested. Okay, so these are the areas, the link, the resources where we got all this information, CDC, WebMD, and what have you. So thank you very much. So that is the end of that presentation. Okay, so I'm gonna call on Dr. Sunday to talk a little bit about the bivalent booster.
Well, we have the new booster for the COVID-19. It's called the new bivalent COVID-19 booster. This booster is available in Pfizer and Moderna. The Pfizer one it's okay for 12-year-old and older. They could take the Pfizer vaccine, the booster. And for the Moderna, you have to be 18 years or older to be able to get that. So the Pfizer is recommended for anyone that is 12 years or older, and the Moderna, you have to be 18 years to get that and older. And it is recommended that to get the booster, you must be at least you must make sure that your last booster that you got is about 2 months from getting the new booster. So maybe the last one you got must have been 2 months away. So you must wait. If the last booster is just the one you got is about a month ago, you have to wait for exactly 2 months to be able to take the new booster. And if you've contracted the virus within 3 months, it is recommended that you wait 3 months after the infection before you can get this new booster. That is the new recommendation from CDC regarding the new booster that is available. If you're 12 years old and younger, and older, you can take the Pfizer. But if you want to take the Moderna, you must make sure that you are 18 years of age to be able to get that. That is the update regarding the bivalent COVID-19 new booster that is available for everybody to get now.
Excellent. Thank you so much for that. So I'm going to share with you something that is called positive test flow. I know we've all been like COVID, like tired, but I just want to go over this so we have a clear understanding of what to do if you test positive for COVID-19 or you're in close contact with somebody that tested positive for COVID-19. So this chart will really help you. If you want to take a screenshot of it, you can take a screenshot of it, but I'll also post it in the WhatsApp chat. So let's look at the left side of it. If I tested positive for COVID-19, what do I do? The first thing you do, of course, you still have to isolate yourself regardless of your vaccination status. If you tested positive, very, very important, you know. So after 5 days, are you still having symptoms or did your symptoms improve? So remember, it used to be 10 days. Now it's 5 days. So if your symptom improved after 5 days, yes, that's the green part. You can end your isolation. And if you have not had fever for 24 hours without medication and you're feeling well, you can still wear your mask. You wear a well-fitted mask when you're around people. It's still recommended that even up to day 10, you keep your mask on, you don't eat around people, and especially you don't go around people that are like very susceptible to getting COVID-19 or their high-risk population. So you want to be mindful of that. So we're going to go to the next area. What if you're still having symptoms, your symptoms have not subsided even after 5 days? You know, you want to continue isolation until you are free from fever without medication after 24 hours. So if you're still taking Motrin or you're taking Tylenol, you took it yesterday, today if you're better, you have to wait until tomorrow. 24 hours without medication, fever-free. And then you can follow this last part up until the 10 days. But even though we say 10 days, if for whatever reason, there have been cases where people have extended symptoms. So if you're really not feeling well, you know, you don't want to put yourself to go to work or go out there. You still want to be safe. Right. Let's look at on the other side of the chart. If I come in close contact with someone who has COVID-19, what am I going to do? Do I run away and go and hide? Like we're doing in the beginning, we all go and hide. No, you don't have to hide. So the first thing you want to think of, are you fully vaccinated? Are you boosted against COVID-19? Or did you have a confirmed COVID-19 positive test within the past 90 days? If you have a yes to all those answers, then you don't need a quarantine because you have already been boosted and you have been vaccinated. So are you fully vaccinated against COVID-19? If it's yes, it goes further to explain. It goes into more details. Has it been less than 5 months? Is it less than 5 months since you got the visor and your booster 2 months? Is it very recent? If it's more than 5 months, that means it's a no, then you have to quarantine for five days. That's you're hearing on the side of caution. If you feel like I got my last vaccination last year, because some people didn't get the booster, or even the second booster, people didn't get it. So if you got your last vaccination about last year, and now you're in close contact with somebody, you want to be careful. You want to test yourself. If you test yourself right away and you're negative, you still have to quarantine until at least 3 days to test yourself again to make sure you get that clear negative before you know that, okay, I'm free, I'm good to go. So that's what it's telling us. But if your vaccination is less than 2 months or less than 5 months or vice, then you're good. You do not need to quarantine. And then we have this other side that says, are you fully vaccinated? No, of course. If you are not fully vaccinated, you have to quarantine right away. So for those that have not been vaccinated, because there's still some people in our audience that are not vaccinated, if you're in close contact with someone that had the virus, you want to quarantine for 5 days. And then, of course, test yourself. So that's why we always make the testing kit available to you. If you need some, you can stop by our office at 1121 B Channel and pick some up, or you can ask us to bring it when we come to South Jamaica for those in South Jamaica, so you can have it, during the survey, we can give it to you. So that's basically the overview of the chat. I know it's something that sometimes I have to go back and look at sometimes because it's ever evolving and ever changing. But this protocol, the way it is now, has been like stable like this for a while now. So I think that is a little bit comforting. But still, as a reminder, the COVID-19 virus is still, the transmission rate is still high. So you still want to be careful as much as possible. If you're going into like an area that has a large population of people that you're normally not around, you want to wear your mask and protect yourself and protect your loved one. Also, as a reminder, day one is regarded as the day after your symptoms began or positive test date. The day after your symptoms began or the day that you test positive. That is your day one when you're counting how many days that you're isolating. So that is that. I'm going to see if there's any question before we move on to the next section of our presentation.
Hi, I have a question. Good night, everybody.
Good night.
So with the new bivalent booster, is it an mRNA booster like the Pfizer that was the Moderna mRNA, or is it something different?
I'm gonna let Dr. Kony answer that question. I know it's a combination of all of the different variants that we have. That's what they have used to do, but I'm not sure if it's mRNA. I've not studied that. Is that mRNA?
Yes, the boosters are mRNA type vaccines. It's just that they include the strains of the original strain and the Omicron 4 and 5 variant. But they are mRNA boosters.
I guess
And
it makes sense because the Moderna Pfizer.
Sorry?
I said I guess it makes sense because the Moderna and Pfizer. So okay.
No, that's what they are. And
no, I'm agreeing with you. I say it makes sense.
They're recommended. The J&J has really fallen out of use because of it's not as effective as the mRNA vaccines. So the recommendation now is for anyone who got a J&J should get a Pfizer or a Moderna booster. Right now what's happening is if you are not vaccinated, they will vaccinate you for the original strain. You'll get the 2 vaccinations, the 2 injections for the original strain. And then 2 months later, you should get the booster with the bivalent vaccine, which is mRNA. So that's the recommendation. No problem.
Thank you. I just have one additional question to add to that. So with the bivalent, is it only a booster or someone who's never been vaccinated? Can they get that as a first dose?
No, it's only for those who have been vaccinated. If you have never been vaccinated, you will get the original vaccine. You'll get the original Pfizer or Moderna, which is recommended now. So you'll take those 2 shots according to the protocol. And then 2 months later, as a booster, you can get the bivalent vaccine.
Understood. Thank you so much.
Okay.
Any other question? Thank you, Dr. Kony. Any other questions? Okay, so
In the chat.
oh, yeah, yes. I think I addressed those questions in the chat apart from Sister Rosemary. So the question in the chat, the quarantine protocol, yes, I think we addressed that in that chat. Right, Stephen? Are you satisfied with that question?
There's
Steve?
another question.
I know I'm
Yes,
talking.
yes. That
Yes.
addresses it. Yes, correct.
Okay. So the first question with Sister Rosie talking about the disposal of expired test kit. I mean, the expired test kit we returned to the city, we returned to the Department of Health. So Dr. Quinn, did you come across any protocol to dispose of
There's
it?
no protocol, it's regular garbage. It's
Yeah.
regular garbage. They can be disposed as regular garbage. They're not medical waste. It's just regular garbage.
But they don't have no needle in them or anything like that.
No,
So
no. Mm-mm.
okay, so we want to talk about the mRNA. There's a question.
Okay, so mRNA is is the short, the nickname for messenger RNA. So we have to go back to biology, and you have you have different types of ribonucleic acids. All right, you have DNA and you have messenger RNA. So it's a single-stranded molecule, whereas DNA is a double-stranded molecule, nucleic molecule, and it's a strand of your genetic material that everybody has in all of their cells. You have DNA and you have mRNA, ribonucleic acid RNA. So it's just part of the makeup of your cells. I don't know how to better describe it. Yeah.
I put a link in the chat that talks in depth about mRNA. I see you, Sister Donna. I'm going to acknowledge you in a minute. So that speaks about the mRNA and how it relates to the virus and some of the things Dr. Crony explained. So you can click on the link after this meeting and really read on it if you want to dig deeper. Sister Donna?
Yes. Okay. I just want to clarify this for myself, right? So you're saying that, like in my case, I took the J&J 2 boosters. So you said there, I have to do another one. I have to do the Pfizer based on what Dr. Sunday was saying.
Yes, that's the recommendation now, that anyone who got the J&J should get either Pfizer or Moderna, because the effectiveness of the J&J is not as good as the messenger RNA based vaccines. So they're recommending the Pfizer or the Moderna as your booster.
So I have to take one booster or 2?
It's one booster right now.
It's funny, but I've never been tested. I mean, I understand, but we've never been tested like positive, and I did the J&J. But anyway, I see what you're saying.
I mean, the J&J gives some kind of protection. It's just not the same with the percentage of protection it gives is not the same as Pfizer and Moderna. So, but that doesn't mean it doesn't give some kind of protection. So the bivalent booster we have now is for everyone. So if you've gotten your 2 shots from Pfizer or Moderna, and you never got a booster, or you got a booster and it's over 2 months since you got that booster, you can get this bivalent. And the bivalent is stronger because it has all the other strains in it. So yeah, I wanted to clarify that.
Okay, thank you.
I have a question.
Okay.
Yeah, hi.
Go ahead.
Good evening, everyone. Okay, around May or prior to that, they talked about of us having the boosters, right? Now the Virulent, which is the newest one? Because I haven't been working a while, so I'm not really up to date until you tell me from what I'm hearing from you. Is this one a new one that supersedes the other one, that bypassed the other 2 that we were supposed to have? Is this the latest one? That
Yes.
is in the okay.
Yes,
So,
this bivalent
mhm,
is the latest booster. It includes the original booster. It has
mhm,
two things in one. So
mhm.
it includes the original booster and it covers the Omicron, which arose in late December. And then later on in the spring, we got the BA.5 variant of the Omicron. So
Mhm.
it covers that. These are two very aggressive strains of the of COVID. And so this new
Mhm.
booster, which has just been released, covers the original and this very aggressive strain.
Okay, if someone already had two boosters, so they will need to take this one,
Yes,
or that will have been the fifth vaccination then. This will have been the fifth vaccination. The two
yes,
original one, the two boosters in
yes,
addition to, okay, I understand.
yes,
Okay,
yes,
but if someone did not have the two boosters and now they are going to have this booster, so this booster will be sufficient enough for the
yes,
two that they did not have?
yes,
Okay, got you.
yes.
Wonderful. Okay,
Okay.
thank you very much.
Okay, I see your question, Steve. You are asking if somebody contract the COVID-19 virus, does that provide another level of protection? I have my hands to
Yes,
that, but I'm gonna let you go answer.
yes, it does protect another, it does give a level of protection, and there's a protocol for getting your booster after you've had infection with COVID. I think it's a little bit longer period of time before you can get the booster. So it does provide a level of protection, but it doesn't last. That's the problem with the natural immunity, is that it wanes also. So that's why they're recommending to get the booster, even if you've had natural COVID infection and it has some immunity, but that immunity wanes as well.
So I just show you something quickly. If you look at this chart that we looked at earlier, that was part of what it said. It said if you've had confirmed COVID-19 in the past 90 days. So just like Dr. Kone said, you can see that it's something that is effective, but it doesn't like last. You still have to get the booster to support you for that long lasting immunity, which we don't know how long it lasts, but at least it's better than the natural one. It lasts a little longer.
Yeah, the whole thing with this is, this is, as we've talked about many times on this platform, this is a new area, right? This is a new virus. We've been through several waves of this virus, and each time that we think that we've overcome it, the virus has mutated, has come up with all of these variants and shifts us into another area of that we didn't anticipate. So with that being said, I think it was either last week or week before when we showed the slide that even though everyone is not really talking about COVID, and a lot of people think that COVID is over, we're nowhere near the levels that we were even in March of this year. There's still high transmission rates, high rates of infection around the city. And by no means are we done with COVID, or COVID, I should say, is done with us. So we're learning as we go along. Yes, I hear it's a lot of shots, it's a lot of injections that all of us have taken. But if we want to, the things that we know that are factual is that people who have gotten vaccinated, even if they contract COVID, the course of the illness is less the severity of the illness is less than what than people who have not been vaccinated. So we know that for a fact. The rate of hospitalizations and the number of deaths in people who have been vaccinated is far less than people who have been unvaccinated, who are unvaccinated. So yes, we're taking these shots. I think a couple of weeks ago, somebody asked, how many shots can you take? You can take a whole lot of shots. And we've proven that by the immunization of children. Sometimes, when a child goes to the pediatrician to get immunizations, they may give them upwards of 10 different vaccines at the same time, and nothing really bad happens to them. So our bodies are well equipped to handle, upwards of 10,000 vaccines at one time. So it's not, we don't want that, but this is what we have to do in order to survive.
Okay, I see a long question from Steve. So I think one of the first that I'll just address with that is, it all depends. Sometimes your body system, well, let me read the question first for those that may not be looking at the chat. He asked two questions. One is, I did not get my second booster because I contacted COVID in April. I'm skipping the second booster and wait for this new vaccine. Is this a good clinical approach? And the next question says, something baffling to me. I attended a conference in July and I was very closely interacting, very close contact with people who contracted COVID, but I didn't. Why is that? I mean, I think sometimes you can't just figure out why some people get it, why some people don't get it. There's been people in open gathering where some people will get it and some will not. Even so, all of them might be vaccinated. I think it has to do with your body immune system, or maybe the level of your interaction with the people. I'm not really sure what causes it, but sometimes I've heard of cases like that where people are in close contact with people and some get it and some don't. And also the one about the good clinical approach, I'm not sure if it's a good clinical approach, but at this point, we have the bivalent. You can get the bivalent now. You don't have to worry about getting another second booster. Right now, the bivalent supersede the second booster that you missed or that you didn't get. I don't know if Dr. Quinn want to add anything to that.
Yeah, there was an article in the New York Times, I think it was last week, addressing that same issue as to why some people get COVID and others don't. There've been many documented scenarios where a whole entire household has COVID except one person, and they're in very close contact. So this is an area of research now. We don't know what is different about certain people and why they don't get it, even though they're right in the midst of it. Healthcare workers who at the beginning of the pandemic with no protection, etc., didn't come down with it. Others did come down with it. So these are all questions that are being researched now. Don't have answers now.
Yep. Okay, we're gonna move along. It's been really very interactive today. You guys gonna give yourself a round of applause. You've been like very engaged, inquisitive, digging deep. Excellent, excellent. So we're gonna move along to another topic. We've changed the title of our seminar, webinar on Monday to be health awareness, because it's not just about COVID-19 anymore. We're talking about COVID-19, health issues in the community that our audience are concerned about. And now monkeypox virus is right around the corner, is right with us. So we're actually one of the grantees from Department of Health and Mental Hygiene. So we're going to be talking about that every Monday. So we have Dr. Lumna with us, who is the program coordinator for that particular project. So she's going to come and give an overview on what is going on with that particular virus. Lumna?
Hello, everyone. So I'm going to talk a little bit about the vaccination now. I'm going to share. Should I share? Or?
Yes, you can share. I made you
One
co-host.
second. One second.
While Lumna is getting ready to like share our screen, I can just make my announcement. So tomorrow we have Niabule. For those of you that don't know, Niabule is another initiative that we do to support families in our community. You know, so I'll share the link at the end of this seminar.
So for monkeypox vaccination, now walk-ins are available for first dose only, not for the second doses. Now they have approved second dose who had the first dose on or before July 23rd. They can go for second dose for monkeypox vaccine. You can go either on vax4nyc.gov/monkeypox, or we can help you to make an appointment. You can text MPV at 646-715-2009. So we can help you scheduling appointment for monkeypox vaccination. So they extended the criteria for eligibility for vaccination. They extended to sex workers and those who were forced to engage in survival sex or any other type of transactional sex. For example, sex in exchange for shelter, food, money, and other goods of any sexual orientation or gender identity. So the walk-ins are available at Central Harlem and Tremont Center in Bronx. There are citywide, there are city sites available for walk-ins. But it is recommended that you make appointment because there could be a lot of people over there, so you don't want to go there and just not get it done. So it's recommended to have appointment schedule. And we are at Relume have like certain slots, so we can give priority to our people. You can always text again at 646-715-2009. Thank you.
Okay, excellent. Thank you, Dr. Luna, for that. So you guys, you've heard it, you know, so at Relume Foundation, we're providing trauma-sensitive care to the people in our community regarding this. So I know it's really a very sensitive case that as like sometimes people attach stigma to it, but there's no stigma that should be attached to it. You know, if you're in need of the vaccination, you know anyone in need of the vaccination, you can always reach out to us at that number. I will also share the flyer that has the number. Just text MPV vaccine to that number and somebody in our team will call you within 24 hours, then they will schedule the appointment. And if you know of any group of people that need maybe training or teaching young adults, whether you work with young adults or maybe your community association or someone you know that needs maybe some teaching or some seminar, we can send our team over, you know, to be able to support. So the main people we're working in is 11691 929394 11433 11434 11432. So anything in that area, you know, we can send someone over to support with training and with we don't directly give the vaccination, but we can schedule the appointment and give the resources that is needed to get them there. So yeah, so that is about monkeypox. Any question regarding that? Any question, comments? Okay, I think there's something in the chat. Let me see. Oh, you just said thank you, Dr. Lumna. You get a lot of thank yous. Is there any chance of Magnolia play any with the creating Zoom? It could be maybe one of to get this thing. I don't understand that question.
Okay. I just wanted to know, because back when you first started Niabule, you didn't get a lot of people to come down. And then I had asked the question, is it possible for them to view it another way without having to come down? Because that particular play is powerful for a lot of kids. So could there be a way of having it done via, you know, via Zoom or some other way, you know, that a lot of kids can view it, because it's tremendous, the information from that.
And okay, we can talk about it offline. If you have any ideas or you have a group that you feel will be interested in coming to Zoom to view it, then we can make that happen.
Okay.
We're open to have that discussion. Absolutely. Dr. Lumna, can you stop sharing your screen so we can see the people? Yes, we can definitely make that happen. That's a good idea. You know, willing to explore that. So, so for continuation of our conversation, if you guys are on Clubhouse, you can join us on Clubhouse tomorrow at 8 o'clock. We'll be talking about monkeypox virus. So Steve will be our host. You know, he will be like, you know, talking about it, and we're gonna be there to join him. So if you're able to, you can join us, and we're also gonna be on the Zoom platform. There's a different link talking about the Niabule, you know, and you guys have already been Niabule, you know what it's all about. So,
Can I ask a question, please?
Absolutely, yes.
Yeah, I watch everything, but what I want to ask is that, are you going to talk about polio?
We spoke about polio a couple of weeks ago.
We'll speak about it. We'll speak about it next week. There's some information to share.
Okay.
All right.
So if you join us next week, we can definitely share that information.
All right. Okay. I'm interested. Why I missed the last one is that I had an injured toe and I ended up in the ER. So I'll be your hope next week, please God. Thank you. But there's everything that I heard is important. It's the same thing. Continue to bring it on. All right? Okay.
I have a quick question.
Absolutely. Go ahead.
Yeah, I know tomorrow Niabule is 7:30, but then you said something about this another program at 8 o'clock.
Yes, I know we have to program that's like over each other. But the Clubhouse is mainly for like young people, you know. But
Okay.
I mean, elderly people can go to, you know. But we choose which one.
I'm so young. What do you mean? I'm very young.
I'm young too. I feel like I'm young too. I'm gonna be at the Clubhouse, so I attend like 30 minutes and I'll jump on the Clubhouse.
Okay, thank you.
Okay, great, excellent. So I'll share the information with you guys on WhatsApp. I have all of your contact. Thank you. I don't know if Florence wanna say anything about Niabule before we close the platform. I don't know, I'll put it on the spot. Florence, are you there? Okay. Okay, no problem. Okay, any other questions, comments? Okay, so let me just show, I'm trying to find the link to Niabule. Okay. I'm gonna put a link in the chat in a
You
minute.
want the number? I have the Zoom number. You want that? No. Yes, no?
Say that again?
No, it's all right. I'm gonna put what I have on the Zoom, on the chat.
Put it on the chat? Okay, great. Excellent.
33887035. Okay. Dash 3388 dash 7035.
It's 848-3388-7035. Yes. That's the Zoom link. Excellent. Thank you. Okay, thank you, everyone. If you don't have any more questions, I'm gonna close the room. So I'll see you guys tomorrow at 7:30. I'll send the link on your WhatsApp.
Thank you.
Okay, have a blessed night, everybody.
Thank you. Good night, everyone.
Good night. Good night.
Good night.
Hi, Beverly.
Good night, everyone. Be blessed.
Good night.
Good night.
Bye.
Thank you very much.
Hi, Gwen.
Good night.
Good
Hi,
night.
good night. Hi, Naomi. Welcome back.
Thank you. Good night.
Good night, everyone.
Night.
Good night.
Good night.